Good morning, everyone. Hello, hello, and welcome to our webinar today with the CMEP TA Center, the Community Mental Health Equity Project TA Center. I am Ayana McGee, she, her pronouns, and I am the co-project director on this TA Center. And I'm very excited to just be sharing space with you all today. We've got a fantastic presentation lined up. And I see a lot of familiar names in the chat. Hello, friends and colleagues. It's good to see you. All right. So today, if you're looking for a webinar on data and advocacy, lessons from the AAPI group in LA County, you are in the right place. A quick disclaimer, this training is offered through the Community Mental Health Equity Project, TA Center, which is funded by the California Department of Healthcare Services and administered by the Center for Applied Research Solutions, CARS. The views, opinions, and content expressed in this presentation do not necessarily reflect the views, opinions, or policies of the California Department of Healthcare Services. I'll jump into a little bit of overview about our project. So the CMEP TA Center is a multidisciplinary team. We're very excited to be working with many partners, such as the ones who are bringing you this presentation today, Special Services for Groups. It's a partnerships of agencies with expertise in cultural competence plans, health equity, research and evaluation, and all sorts of topics related to reducing disparities in California. The goals of this project are to increase expertise, again, in cultural humility, health equity, stakeholder engagement, language access, workforce diversity, and trauma-informed care in service delivery at the local and statewide level. Our aim is to provide training and resources to both county agencies and community-based agencies as you all work on important things like developing cultural competence plans or partnering with other CBOs in your area. And we aim to make that process easier through the types of resources we provide. Our values in everything that we do are rooted in equity, in anti-racism, and being trauma-informed. We value lived expertise and community engagement. And in everything we do, we also value collaboration and knowledge transfer, as well as data for equity, much of which you'll see in this presentation today. We also aim to live that out in how we do our webinars. And so you'll notice that we put that to practice. So we like to start off with the music, of course. It's culturally affirming. It's a way to get jamming, to take a breath as we get started into the deep dive of this work. We also aim to use inclusive language that's non-stigmatizing, that's LGBTQ plus affirming, that's anti-racist as well. And so you'll notice that we don't use terms like crazy or insane when we're talking about mental health or behavioral health issues. We are also very respectful of pronoun use here. And so I encourage everyone to be mindful as we move through this space together. Who we serve. So as I mentioned, our aim is to serve behavioral health departments and community-based organizations. Many of you in this room may be ethnic services managers, perhaps MHSA coordinators, or other county level staff. You might also be coming from a CBO or a faith-based organization. Wherever you're coming from, I'm sure this training opportunity will be very valuable for you. So we're excited to have you here. In our services, we offer an array of virtual learning opportunities and practical resources. So obviously this webinar opportunity, we're going to be holding more throughout the year, but we also provide more focused learning opportunities like leadership academies and learning collaboratives, which we'll be providing through the summer and fall, all on a variety of topics related to behavioral health equity. And so you'll hear some more about that during this presentation as well. All of these services are offered at no cost. Free, you like it. All right. So I am going to hand the mic over to Trang to talk about our presenters.
Good morning. Thank you so much for joining. I'm so glad to see familiar faces and names, and also from all over California. So welcome to join the morning with us. I wanted to give you a little bit of a background on our webinar today. Our three presenters, we're very excited and thankful for them to join us and share with us their work experiences. So I'm part of SSG, and we're one of the partners with CARS and Beam and PIRE and CalMesa and DHCS and all of our group. We've been working to think about about what are some of the knowledge and information that we could share based on our respective working experiences in California. And so this is one of the many different collaborative learning process, if you will. So for this particular one, we are focusing on the use of data. And we want to connect this. We want to share with you that this is one webinar, but there are two counting collaborative learning series that's coming up in March to July. And we hope that this is the information you get from this session may connect. So one of the series is Medi-Cal certification training. So we're going to focus on the nuts and bolts of Medi-Cal certification. It's a series of 4 sessions. It is monthly, and it really is going to help folks, both county and CBOs, to think about getting ready for certification. And again, some of the data, conceptualization of data might be useful related to that. The other series that we're excited about that's coming up also, that data and advocacy and use of data may come into focus again, is the building bridges between CBOs and counties through contracting as a pathway to equity. So that's also coming up between March to July. So we kind of want to connect this particular content to sort of ongoing further series that's coming up ahead. For our session today, I wanted to kind of frame it really quickly that I'm very fortunate to be able to have worked with all 3 of our presenters. And this is part of why when we think about data, we thought we want to share with you our experiences in LA County. So all 4 of us have worked together in various capacity. And we have learned over the years that for equity and reducing disparity, data is really important. So we want to present to you 3 different angles. So for today, Erica is going to start us with, can we go back to, so Erica June, who's our presenter, who's going to talk a little, she's co-director of the SSG research and evaluation team. So she's going to start us off to have us think about the different types of database that's very common that we have access to, that's useful, both in her work as well as the data set that we've used in all of our advocacy work. So Erica will be starting us with that. And here's her bio. Please take time to look at it as we go along. Mariko is going to talk to us about her work. Mariko was the director of Pacific Asian Counseling Services in LA County. She's also on the board with the Cambodian Chamber in Long Beach, working a lot with the Cambodian communities, and also was very active with the current AAPI Equity Alliance, but formerly called Asian Pacific Council on Policy and Planning. And Mariko and I have worked many, many years doing advocacy and just pulling out data and getting data together and going everywhere and say, look at the data and look at the disparity for our AAPI communities. So Mariko is going to share her lovely experiences. And Huang is our 3rd presenter. Now, Huang used to work with the Board of Supervisors Office, Solis Office, but Huang is currently the policy staff over at AAPI Equity Alliance. And Huang and I are currently working on some advocacy stuff in LA County. So he's going to talk to us a little bit about thinking about using data in advocacy work in policy and politics and some of the political tips and tools. We want to frame it as our working experience has been with the AAPI population in LA County. So please know that we're using it as an example because it's what we know, right? It's from our hearts and our daily work. But please think about how you would use data in different ways in your own county, for whether you're CBOs or counties or ESM. And again, the germination of this data session is because we have heard from listening sessions from different sources that use of data is very important in our work of equity and reducing disparity. So that's kind of the gist of how we came to do this session. So any questions, please defer. What we're going to do is go ahead and go right into the session. I'm going to turn it over to Erica. Thank you.
Thanks so much, Trang. So as Trang mentioned, my name is Erica Jun. My pronouns are she, her, hers, and I'm with Special Service for Groups. This is the agenda that we have for today, and each of us is presenting on a different topic. I'm going to start us off with identifying and accessing data tools. This is really meant to be, my section is really a very basic training, just presenting on some of the resources that are out there. We really encourage you to reach out if you want individual TA or if you have other questions. I think Jeremy is also taking note of any questions in the chat, but I'm happy to take questions as I go along as well. So with that, get started. So we all know that we need data. So these are just some data sources that across the different tiers of national data, state data, local data, community data, and other types of data that are out there. We are hoping to help you to learn how to look for, use, and talk about data and data sources. So these are just some examples. There's obviously other sources of data that you all are probably familiar with and use on a daily basis. With this, I want to caveat before I start just this idea of what is data. And I think what we're all probably used to when people talk about data are hard statistics. And numbers and trying to get the sense of what is seen as a fact. And I want to challenge that idea because there's a lot of data missing on especially smaller communities, underserved communities that are often invisible on the mainstream. And so how do we get data, or how do we make sure that people see those communities and the people that are often left out of the hard statistics? And so I would encourage you all to think about what gets represented as data, whether it's through proposals or advocacy, and think about, even collecting your own data if that's possible. Especially for smaller communities, it's helpful to be able to, a lot of the community organizations already know kind of on the ground what's happening. And can you collect that data in a more systematic way so that you can make the case for the issues, the gaps that you see? But for today's purposes, we are focusing on these two data sources, the US Census and the California Health Interview Survey. So looking at the US Census Bureau, what type of data is available? There's what is known as the American Community Survey, and these are 1- and 5-year estimates. Because there's a decennial or every 10-year data summary for the US Census, the American Community Survey often gives us estimates in between those big 10-year census data collection. There's also the economic census, there's mapping, and I believe a lot of the 2020 census data is has been released, but there is additional reporting that is still in progress. So with that, I want to say that, the US Census revamped their page recently, or I guess last year. And here's an idea of the types of data that are available on the data.census.gov. So you can see the American Communities Survey and the years that they're available. And basically, there's a lot of data. So this is just a sense of, there's a lot of data. Part of this is getting familiar with the websites. So I'm going to switch from the slides and basically take you to the website, and we'll explore the census website together. This is the census.gov website. But what we want to get to is the data.census.gov website. If you don't remember that, you only remember census, you can go to data and maps on the census website, and then go to explore data on data.census.gov. So now we're on the data.census.gov website. On here, you'll see, for those of you who have used the census website before, this is a lot more minimalistic. So they've cleaned up a lot. It might be very difficult for those of us who might be a little bit more used to the old website. But if you familiarize yourself with it, there are a lot of features that they've added, and they've tried to add in tutorials and resources to make it more user-friendly. So at the top right here under Explore Census Data, there is a search bar. This is what the census folks like to call the single search bar. Here is really for, they want you to use it for quick statistics. So if you have something that you want to look up quickly, like a single statistic, it's like the uninsured rate in California in 2020. So it will give you a simple statistic. Without healthcare coverage in California is 7.2%. The way that they got to this is it's the best guess of the health of a statistic based on the search terms entered in this single search bar. So you can see on the left here, it has the filters 2020, the year, California, the state or the location that you put in, and then probably searching for uninsured. So this is a best guess. If you really need a quick statistic, that's what they're using it for. It points you to the tables that this information can be found in. And so you can see that there are a lot of different tables using a lot of different sources. This says there's 1,135 tables. You're probably not going to look through all of those tables, but you might find that, that first likely table of selected characteristics of health insurance coverage in the United States might give you what you need. So this single search bar is useful for that. You can also see that it shows you some additional statistics about and information about the state of California, gives you other possible related searches. If you go to the table, the first one that was there, you can click on it and it will load a lot of additional information breakdowns by age, sex, race and ethnicity, living arrangements, and other categories. So you can look through it and see what are the different breakdowns if you want to think through other types of categories that you also want to search. So if we go back to clicking on the United States Census Bureau logo, it'll take us back to a clean page with a single search bar. Next, I want to show you the advanced search. So you can just click on advanced search here. And this is probably what more people are familiar with, where you can actually choose the filters and think through the topic areas and find your information that way. So it's just a different way of pulling up the information that you need. So there are checkboxes. So let me go through that quickly, slower. If you go to geography and then you go to county, it'll show you the state. So let's choose California. It'll show you all of these different counties. So you can select multiple, you can choose one. Let's go with Los Angeles County because that's where I am. And then we can go to topics and let's look up something related to health. So if you do a health search, and let's do 2020 as a year. And here at the bottom right hand, there's a search button. And similar to the single search, you can get a simple statistic. It'll also give you different tables for looking up that data. What I like about the census website is that it also gives you data and maps through tables. You can also find a lot of tutorials if you scroll down. And it will also give you these place profiles. So you can find additional information on a specific geographic area. If you scroll all the way to the bottom or even just hit help at the top, you'll get access to these different tutorials. They're short videos that walk you very carefully through the steps to do those searches on your own and to be able to use the information. And they're also open to getting your feedback and helping with searches. So this is the census data. Let me see. Are there any questions so far? No. Great. So then next I wanted to move us to the AskCHIS website. And that's California specific. And so let's see. Okay, so for the AskCHIS website, this is through the UCLA Fielding School of Public Health and the Center for Health Policy Research, and with funding by the California Endowment, Kaiser, and Wellness Foundation. But it's a very useful health data tool for looking up California-specific health statistics. There is now AskCHIS. CHIS stands for California Health Interview Survey, and AskCHIS Neighborhood Edition. And they basically survey about 20,000 Californians each year on various topics. You can see the questions or topic areas that they ask. And then you have a general estimate of the different populations in California for different topics. So we'll go to AskCHIS first. And first off, you'll have to create a login to be able to use AskCHIS. It is free, it's completely free, but you do have to create a login. And then let me put that in first. And actually what's helpful about when you create the login is that you can save various searches to your library. But let's start off with selecting a geographic area. And AskGIS actually walks you through this process. So you can search by county and region. They actually have Los Angeles County Service Planning Areas and San Diego County Health Regions as well. If you do not select anything, then it actually defaults to the state of California. So I'm going to choose Los Angeles County and Orange County. And then you hit next on the bottom right. And here you can enter a topic area if you have something in mind. What's helpful for me is actually selecting the category, because then you can actually see submenus and topics that are more specific. So since we are dealing with mental health, let's look at the mental and emotional health. And emotional well-being. So you can see under emotional well-being, there are lots of different topic areas. It will show you the years that they asked that question, the age groups, and actually if you select the button, it gives you more specific information. So you can see that the years that this one was asked was 2015 through 2021 in teen and adults, and that the results will be displayed by these categories. You can also get additional information and actually see how the variable was measured, what source they used. So it's a lot of information. I recommend playing around with these different options to see what kind of information you want to pull up. The questions are asked differently depending on the category, and so you might want to fine-tune your search based on that. So let's go down to likely has had serious psychological distress during the past year. This is multiple years up to 2021. We're only looking at the adult group here. And then I will hit next. So that gets added as our topic. And since let's do a simple search for right now, so I won't choose a compare topic. And then I will just get the data. And so it gives you a table that shows you that the percentage, the estimate of those who have likely had serious psychological distress during the past year. And so you can see that based on this table, according to the source, which is the 2021 California Health Interview Survey, 16%, an estimated 16% of the residents in Los Angeles and Orange County, because that was the geography that we searched, likely have had serious psychological distress during the past year. It's might be an undercount based on, reporting that we often know on the community side, but that gives you an estimate. And then you can see that there's a note here about 95% confidence intervals displayed in the table. So this part in parentheses, 14.8 to 17.2, is that confidence interval. So this says that you're 95% sure that the true value falls between those two brackets. And so 16% is an estimate. And this 1,623,000 is that estimate of that population. Okay. You can also pull down this menu and see compare geographies. So you can compare the geographic area. We did Los Angeles, Orange County. You could also do a single county search. But based on the two different counties, you can see if there's any difference, if they're close. So you can see that there's 16.4% with that likely have serious psychological distress in Los Angeles County and 14.6% in Orange County. You can group them back together again too. You can also compare your total to the state, California. And you can see that it's fairly similar for the rates. 16 and 17, 84 and 83. Okay. You can also add additional topics to compare all of your data. And so I did another search where, so you can see that there in your library, you can save. So for instance, if you take this data and you want to save the search, you could go to your library and do distress. And it'll save it there. That way you won't have to redo the search. And you'll have it, if you can also export it as an Excel table or other, I think as an Excel table, and then you can email it or print it as well. You can also show charts that you can export and pull up trends on that data as well. And this is where it's helpful when the same question has been asked through multiple years, because then you can see whether there has been an increase or decrease across time. You can see that from 2020 to 2021, there is a 4% increase in psychological distress. Okay. One of the comparisons that I did was this one on looking at serious psychological distress during the past year and comparing it with, and also comparing the usual, having a usual place to go when sick or needing health advice. We often know that if you don't have a usual source of care, that conditions can become worse. So here you can see that for 21.8% of the residents of Los Angeles, Orange County that likely have serious psychological distress do not have a usual source of care. And these various health statistics might be helpful or useful in your proposal writing or in your own advocacy efforts to show the gap or the issues that you're trying to address in your communities. There's also, for those of you who are working at county, how you can support community organizations and being able to find the information or be able to recognize the issues that they're facing. You can also add these limits of population if you want to look in specific communities, but depending on the population size, that might lead to some unstable data. So with that, I want to see if there were any questions. Okay. So there's a lot more on the California Health Interview Survey website that I would encourage you to search and get to know more about this data tool. They have a lot of really great resources and webinars to be able to do specific searches, as well as to think through other ways of using that data. The neighborhood edition is particularly good for kind of mapping out that data and seeing your region as compared to others. And that might be helpful for county folks to be able to think through, what are specific gaps or issues that your county faces versus others. So with that, I want to turn it back over to Huang. Thank you.
Thank you, Erica. Good morning, everyone. My name is Huang Nguyen. My pronouns are he, him, and I'm the Director of External Affairs for AAPI Equity Alliance. We're a coalition of over 40 plus member organizations who provide services, direct services, and in a lot of cases, mental health, behavioral health services to the 1.6 million AAPIs who live in LA County. My background comes from government, and so I used to work for the County of Los Angeles, specifically in a supervisor's office as her policy staff, Hilda Solis. And, my experience comes from the inside, and now I'm on the outside, so I'm happy to take those lessons and sort of democratize them, let everybody know about them, what it's like on the inside and how you can advocate and get things done from the outside. And I know a lot of folks here are either community-based organizations or work in the government themselves. And so I hope that, the next several slides I'm going to go over applies to both, because it really takes both entities, right, like CBOs and government working hand in hand in order to get some of the problems that we have solved. So I'm going to be talking about using data in advocacy, and some caveats at the top is that advocacy is mushier than what you usually think data is, which is hard facts and statistics. But advocacy is a lot more malleable, so you can have the most compelling data, you have the most compelling stories, but sometimes and oftentimes you don't get exactly what you want in advocacy. And when we're talking about advocacy, is that we're advocating to the people who have the powers, right? The lawmakers, the people who have authority. I'm not necessarily talking about, management staff at a county department. I'm usually, when talking about advocacy, I'm talking about, the leadership of certain departments, county departments, and then the county itself, the board of supervisors usually, or the board of commissioners of the county, who are elected by the people to enact policy changes. So when we talk about advocacy, we want to do an assessment, right? We need to know our lawmakers. So who are those people in these institutions that can move funding, can change policy to the way that we would prefer, right? For our communities, we have vested interest in seeing certain programs and policies enacted, and vice versa. And so when we talk about that, like, who holds the powers? And so we need to identify those people first, right? Is it your Department of Mental Health leadership, right? Like the director of the Department of Mental Health, or is it the Board of Supervisors or Board of Commissioners in several counties, or is it your state government? So it matters who you're talking about and what kind of policy you're trying to push through. And that will then lead you to identify sort of like, is it the state level, the federal level, or the local level that you need to advocate to? And the next step after that is identifying what matters to the lawmakers that you're advocating to, right? So when you're talking to lawmakers, consider, along with your proposal, what their stated priorities are, and how do those priorities align with you, right? If you have a lawmaker who doesn't care at all about expanding access to health and mental health care, or they don't much care about equity in a county government or local government services, though, those lawmakers do not align with your priorities. And so you have to consider the uphill battle that you're going to have to face when, you're just basically talking to a void. Basically, they're not going to listen to you. You already know that. That doesn't mean you shouldn't try, but it's just going to be much harder for you to get the stuff you want through if you know that the lawmakers do not have, equity in their stated priorities or expanding access to these services, right? Consider their legislative background. Like most lawmakers, usually have past work or past record that they tout, right? And what are those legislative backgrounds? If they have worked on these issues before, like you want to know that, right? Like, because if you have a very supportive lawmaker who is a champion for your issues, you'll want to know that coming into an advocacy meeting, right? Like you want to talk about, like, we appreciate your past work, your past work on this specific issue, and here's how our proposal will advance that work for you. So you want to frame it in a way that helps them, right? Like it's a transactional, so to speak, relationship, because politicians need to be elected, right? Like if we were talking about the Board of Supervisors, they're all elected officials, and so they need to be reelected and elected by voters, and they need accomplishments in order to get elected. So we're talking about really, brass tacks politics, basically. And I know that could be a new arena for a lot of people, but politics and policy goes hand in hand. Without good politics, you can't have good public policy, or you can't pass policy, because lawmakers are politicians, and they need to do what is best for their district, their constituents, or what they view as best, right? And so the next question is, like, knowing who the constituents are, knowing the demographics in their district. So we're talking about behavioral health or mental health. Do you have those statistics, that data that says, this is how many people live in your district who do not have access to care, right? This is, and these are the numbers that break it down by race or by income levels. And so you want to really uplift those, because again, if they're supervisors in the county, they're likely divided into districts, right? And so you're not talking about the mayor of a specific city where they represent the whole city. You're talking about people who represent very distinct districts. And so they are elected by those voters, and they want to do things, accomplish things for those voters specifically. And so uplifting who lives in their district, who are their constituents, really matters, because that's all they think about from a day-to-day basis. I used to work in such an office, and so we only focus on our districts, right? Like our constituents. If somebody comes in with a policy proposal that, like, sort of is unrelated to our district, we don't really even work on that. We don't take those meetings, or we don't like try to advance it forward. But if you're talking about like a state, right? Like the state has a responsibility to everyone in the state. And so that's different. But if you're talking about a supervisor, that's sort of, the things that you have to keep in mind. And the next part is who has influence on the lawmaker. And this is sort of down the line of your advocacy, right? Like if you're talking, you keep advocating to the same people, and it's not really working. Your proposal is not moving the needle much. You may need other allies who has an influence on the lawmaker, and you need to be able to identify those influencers, right? Like whether it's a union group or it's a special interest group, and do those influencers care about what you're trying to propose as well. And this is more advanced advocacy, but maybe those influencers have a better time getting through to the lawmakers than you will. And can those people carry your message and say like, hey, can you go talk to so-and-so because they're not listening to me, but they would listen to you, right? Like there needs to be another backroom strategy, another path basically that you need to have as a backup plan. And, at the end of the day, these folks are elected officials. And so knowing when their next election is matters, because typically you will find that politicians ramp up their work, ramp up their offices, official work, when their election is around the corner, right? And so, if they're elected 4-year term, the first 2 years, you may not even hear from them. But then the second 2 years, when they start running again for re-election, you may find that you have an easier time advocating to these offices using your data, because, they're in an election year, they want good press, they want good, they want the votes. And so, and they want the issues. They want to talk about the issues and say that they did something about these issues. And so it's important to know this timeline. So like where they are in their term in order to effectively advocate using your data. And so I focused a lot on, that was the elected officials slide, those official lawmakers, right? But you're going to be also talking to government entities. So this is, anyone in the departments, anyone who work for a department, their staff, their senior leadership, all the way down to the line staff, right? You have the middle management that you talk to on a day-to-day basis if you do contracts. And so all of those folks, you have to assume, some of them will know the historical context of the AAPI communities, or your specific communities. Some of them won't. A lot of them won't, right? Like they will, they stick to their jobs and that's all they know. And that's fine, but that's why you have to put your data into context. Depending on who meets with you and who you're advocating to, the diversity of your communities, the history of your communities may not be known, may not be understood. And so why is it important for us, for example, in the API communities, to put our history into context is because, well, our cultural backgrounds, often leads to APIs not accessing mental health services or health services by government entities. But the government entities may not know that. They may assume like, oh, APIs are just not interested in accessing our services. But, when you look at our history, that's not the case. We just, we come from many different countries with failed states. And so our trust in government is not inherent as it is in America. And so that is important, right? Because then we can say that like, because of this history, we need to do proactive outreach to AAPI communities or to the Latinx communities, to the African American communities. So all of that matters, and you always have to assume that you're starting from the basics with whoever you're talking to within the government. The next one is presenting the data in a very easy to digest format, because that I think the assumption is that government officials love to read and write reports, but I can tell you that that's not necessarily true. A 20-page report may not get the same level of digestion as a one-pager. I think it's all inherent to us, but I think like if we can sort of have an executive summary whenever we're presenting data, have a summary page, a one-pager, instead of a 20-page with a lot of great graphs, and that's great if you're talking to sort of like the in the weeds policy staff. But if you're talking to a lawmaker or a government official who's really high up, it's much better because they're time limited. They don't have really capacity to look at your reports. It's way better to have this data be really condensed and digestible. And another thing is to have the stories with your data, right? Like data, like I said, is not enough to move people sometimes. And so you want the compelling stories that goes along with it that is easy to digest. And then the last point is when talking to government entities, you want to consider if you can propose a specific solution, right? And this is again advanced level advocacy, but people like it, especially government and elected officials like it when you can name a number, a specific department, a division, a law or policy that you want to change. If you can name that, that's way better than to have a more vague ask, like, make sure that you are being equitable in mental or healthcare, right? That's too vague. And I want us to think more on the more granular level that says like, I want this specific division within this specific department to receive more funding to do XYZ for this community, right? That is a much more substantive ask that one, the government official will like know what you're talking about and like can imagine, envision it. And two, you get to hold them accountable, right? By having this very specific ask. And when they don't do it, then you know that they didn't do it. Instead of, a vague ask of like, can you be more equitable? Well, they may have a different definition of equity than you do. And so they can say like, oh yeah, we're doing that already, but there's no way to prove it, right? So there's no proposing a specific solution enables you to hold them accountable to the outcomes. And so this is kind of what I said earlier, but what resonates with government officials is data is necessary. So data is a must. If you don't have the data to back up your claims of, our communities are not getting access to XYZ, you need that data first, but it's not sufficient. It's not enough to move people, especially if they're on the other side of what you're arguing. It's not enough to move people, to your side. So in addition to data, you should try to pull compelling stories from your data sets and present both in a narrative, right? So what does this mean? Erica mentioned earlier that, 20+% of the people who said that they had, psychological distress in the past year did not have a source of care. And so can we find a story within that 20% that, is unfortunately going to be a sob story, but it's going to be compelling, right? It'd be compelling to really present a face to the data, right? Like, is it somebody who, right? So you want to think in those terms, because that story is not only useful for elected officials to have, but for the wider public when you need to sort of do a wider advocacy campaign, right? So I'll talk about it in the next couple of slides. But is there a standout case that would resonate with the wider public audience? Like, put yourselves, you just, think about what would resonate with you as an advocate. What would, why is this so important to you? And talk in those terms, as opposed to, always focusing in on the data. The emotional appeal is really important. So you have to also assume that elected officials have competing interests when talking to them about your issue. This means, what I mean by this is, there's always a competing or opposing interest to what you're advocating for. If you're advocating for any sort of change in the system, there are people on the other side automatically that will say, no, we like the status quo, right? And because the status quo to them has been working. And so when you're doing advocacy, definitionally, it means you're trying to change something. And so there's going to be people who says, like, no, we don't think that's necessary. We think it's working. So be it, right? So you have to assume that you always have those opposing interests. And like I said, elections matter. Elected officials can be voted in, and then they can be voted out. And this all sort of coincides with a public-facing strategy. If your internal advocacy does not work. We've been talking about internal advocacy, right? Like, you're talking to our department staff, you're talking to the board of supervisors, you're taking these advocacy meetings. And sometimes it goes somewhere, sometimes it doesn't. And then when it goes somewhere, it's going to take a long time, right? Like, people who work in government know that things unfortunately do not move at a pace that we need them to be responsive to our communities. And so, do you have a public-facing strategy? If it's been so long that, like, you don't even know if this is on their radar anymore, like, can you force their hands? Elected officials do things when they are forced to, right? Government does things when they're forced to. And so can you, from the outside, as an advocate, sort of put the pressure points, or, like, hold the power levers, so that they act on certain things? Because these are important issues. And, the less responsive government is, the more people are harmed, unfortunately. And so we need to be able to, at the end of our internal advocacy road, have a plan B. So what does the plan B look like? These are just some of the things that you can do. So public comments at the board or city council meetings, or like a state committee hearing meetings, right? These are important, and you should exercise this muscle often as an advocate, as a community-based organization. Like, we need to be at these tables, because special interests, those opposing interests that I talk about, are always there, right? Like, they spend the resources, they spend the capacity to make sure that they're there, and so that these elected officials hear directly from them. And so that's why we need to be there, so the elected officials hear directly from us and our points of view, right? Will it automatically change their views? Probably not, but we need to be at these meetings regardless, because if we're not there, the vacuum is filled with the people who are not necessarily aligned with our interests. And likewise, letters and emails to their offices also have an effect, because if they're an elected official, they'll keep track of these emails that coming into their general inbox, or the calls that are coming into their offices. They'll keep track of them, a tally of them. So like, have you ever considered a campaign, right? Like to say like fund, hey, supervisor XYZ, fund this program more, or have equity, make sure that you have equity for this community in your plans, right? Like specifically, those are those can be effective to legislators, to lawmakers, because if put yourself in their shoes, you're an elected official, you see on your daily call tallies that you have 100 calls or 100 emails about this issue. Naturally, you're going to want to like ask your staff or ask somebody about like what's going on here, and see if you need to take a stance or you need to do something about it, right? Like, so that's a very direct way to get to them. A much more public strategy is doing press. So traditional media, social media campaigns, all of it goes together. This is writing an opinion piece or a letter to an editor, raising an issue through a very public way. But in the last two bullets, it's going to be more difficult, right? In terms of like, you need to get the reporter to agree to write your story, or you need to get the editors to be able to publish your op-ed. And this is how your data and your stories will really come through, because traditional media especially loves data and loves stories, telling stories through data. And so they'll like really appreciate if you can craft a story that includes both compelling narratives and data. And so, but this is a very like, you're almost at the end of your ropes, and you have to like say something in the media to be really public about it. And you really don't know how the lawmakers are going to react, right? Like, this is essentially you giving them bad press. And so it's a chance that you're taking about like, all right, I'm going to write this op-ed and hopefully raise this issue in the public arena enough that it will force the lawmaker to respond and do something. And same thing with social media campaigns. I know there's a question about, are emails as effective as letters to legislators? I would say emails are easier to organize a campaign around, whereas letters are harder to get organizations to send a full letter. I think effectiveness, like, someone's going to read your emails just as someone's going to read your letter in the lawmaker's office. And so I don't think that it really matters, because emails, you can get more emails, like, it's easier to do and you can organize a lot more people around it. While letters, they have a little more weight, and the lawmaker can tell that you put effort into it, but you're not going to get 200 letters as easily as you will in emails. So I see a question. How do we encourage our community voices to not give up, especially those who are speaking for the first time? Yes. And so that's very important in organizing, right? Like, to make sure that you give folks a realistic expectation of what they are doing, right? So tell folks that if, send this email or send this letter or post on social media about this, you may not see the change right away. You may not see the fruits of your labor even a year down the line, but know that it makes a difference, right? It makes a difference because, you're getting people into the process. And especially in BIPOC communities, we have been left out intentionally of the process for so long that, even getting normal people to submit a public comment at a board or city council meeting is such a big deal that you want to, validate them, right? Like make sure that you're telling them that this makes a difference. Elected officials don't often hear from us. And so for them to hear from you is important, even if you don't see the fruits of your labor down the line. And it's important for them to be heard. Like it feels good when you're able to just speak to your lawmaker who you elected to do, for them to be there to do a job, right? To serve the general public. And we want people to be able to talk directly to their elected officials. That's how this is supposed to work. They're not supposed to be totally inaccessible, right? We need to change the mindset of, elected officials are somehow celebrities or like they should be hard to reach. No, normal people should be able to talk to their lawmakers who they elected. Okay, so the last question is how much of the correspondence by whatever method that lawmakers actually see as opposed to their staff and office admin. I would say lawmakers don't see the direct correspondence, but they will hear about it from their staff. So you send 100 emails, they're not going to sit there and read through 100 emails, but they're going to hear that hey, we got 100 emails in our inbox from their staff. And they're going to ask questions about it. I mean, what is that? What's going on, right? It's not that you're trying to get them to read your message individually. Sometimes they do. Sometimes some lawmakers will take the time and respond to their DMs on social media or respond to what's in their inbox, but some don't, but they still hear about it from their staff.
I have a couple of questions that were asked in the chat earlier, and I just sort of wanted to elevate them. Can guidance be given on how to search for information for background on lawmakers to understand their priorities and legislative background?
Yes, so I can answer that question and then pass over to Erica. Depending on who the lawmaker is, there may or may not be a lot of information on them, right? If they previously served in Congress or the state assembly or Senate, for example, there's going to be a lot of information on them, and you can just Google them on Ballotpedia or ledge.info. Just Google their name, and a lot of stuff will pop up in terms of their past votes. You can check their websites. Oftentimes lawmakers will post their legislative priorities on their website, or just send them an email. Be like, do you care about this issue? You should practice just getting in touch with your lawmakers. And if you don't know whose district you live in, or who the lawmaker you should reach out to, feel free to email me. But oftentimes you can just say on Google, you can say find my state representative or find my county supervisor or whatever. And then it will lead you to a website. You can put your address in and then you can go from there.
The question is, I would like to know how to gain access to data on the Burmese community.
So based on a quick search, I found Burmese in the US fact sheet from the Pew Research Center. But since the population of the Burmese population in the US is smaller, I think some of the tips to finding more information could be through just looking through articles, particularly in areas that are that have a higher concentration of Burmese, like a kind of well-established Burmese community. If you know of others who are researching in the area of the Burmese population or Burmese community that in the US, being able to reach out to them and be able to actually do see if there are community data pools or if there's actually surveys that are being done there. The problem with looking on a larger larger databases, as you probably already know, is that you're going to have unstable data because the community is probably not oversampled enough to be able to provide stable data. And as Trang mentioned, yes, we can definitely support individual requests for TA. And then Eunice, you have my email, so feel free to reach out. For the recidivism, juvenile justice recidivism rates and the impact of restorative justice programs, I don't know of a database or data source offhand. On a quick scan of sources, I found this, but this is on basically as juvenile justice state profiles. And I'm guessing that you already have that and you want to know about the impact of the restorative justice programs. There is work, I don't know if you've been part of or have heard of the work that the California Community Foundation and LA County Department of Probation and various community organizations have done as part of a Ready to Rise initiative, but that also looked at the role of these different community organizations and restorative justice programs on the youth, but I'm not sure if they look specifically at the recidivism rates.
And it's noted in the chat, but I also want to offer that you can go to the website, cmep.org, for some of y'all who have some more specific questions around accessing data sources to understand disparities in specific communities. For example, I see a question around disability communities. So if you submit a TA request to the CMEP TA Center, we can also support with linking you to resources, providing you with additional supports, or connecting you with consultants who have specific expertise who can help with finding this information as well.
All right, so my name is Mariko Khan. And first of all, I want to thank Erica and Wang because they make my presentation proof in the sense that the case history that I'm going to present about Cambodians in LA County is an example of how the advocacy and the data made a difference to this community, particularly under the Mental Health Service Act. And Trang and I worked on this very hard many years ago. So first of all, let's just put everything, as Wang said, in a historical perspective. We need to understand why and how the Cambodians came to the United States, because it made a big difference in terms of how they were treated. I'm not going to go through all the detail because of time, but of note is that in April 1975, the Khmer Rouge took control of Cambodia. And from that, there was a massive genocide that killed almost 2 to 3 million people. The figures are very difficult to get because there are so many unmarked graves and so forth, but it devastated the country. So around 1975, we started to see evacuees coming to the United States, and they were mainly people who were already studying abroad. In 1978, we saw that Vietnam invaded Cambodia, and that ended the Khmer Rouge control. And this is where thousands of Cambodians fled to Thailand and other countries and were kept in refugee camps, oftentimes for years. About 120,000 Cambodian refugees came to the United States. And why I want to bring that to your attention is that they came as refugees, not as immigrants, not as undocumented. And as a result, almost all of them were sponsored or had to be sponsored, and they were entitled to benefits and documentation, which made a big difference in terms of them being treated in this country differently than our ever-growing undocumented groups. So I also want to share with you some of the comparative demographics. And what's interesting to me is, as I was putting this presentation together, I had some data, And then as I went further into it, I noticed the data was changing. And I think that's something that's very important for all of us to understand, is that data is not static, and it changes from year to year or from census to census. And when you're looking for the data to present to your legislators, try and get the most recent. I don't think I was 100% successful in my presentation, but I think it gives us a good idea. So the first statistic that's important to note is that in LA County, we have 10 million people. And of the 10 million, almost 500,000 or 12% are Asians. So when you start looking at the data, you have to disaggregate it down to the various ethnic communities. And you'll see that the other Asians are almost all the Southeast Asians and new groups lumped together. And this is where the disaggregated data makes a difference to your specific community. The other thing that I just want to note is that you need to look at English language proficiency in terms of how to provide services. So the most recent data shows that American-born Cambodians are 91% fluent in English. But if you look at the foreign-born ones, 43% are limited English access, or actually 57% are limited English. You also want to look at the education rate of your group. That's important because the things that you want to ask for specifically may be related to educational programs and plans. And again, I just want to point out that when I looked at the dropout rate for Southeast Asians, you see 35% of Cambodians did not complete high school. Now, this was, I think, from 2010. It's improved quite a bit because when I looked at the Pew study, it showed that 55% of Cambodians were graduating from high school. But you see, they still have very low rates in terms of college completion compared to other APIs. And then looking at economic justice or poverty issues, I wanted to take a look at how Asian Americans are versus the specific subcategories. And you'll see that in general, 12.6% of Asian Americans live below the poverty line. But when you look at the Cambodians, you're seeing 30% of Cambodians are at poverty level. Again, that tells you a lot about the kinds of services that you will need to provide for that community. You see that even in the median household income, where APIs are at 85,800, but Cambodians are at 67,000. And then I just sort of took a look at the age groups. Again, you want to look at that because you want to determine what services are most needed. And here's some sources to get the data. So as I mentioned before, the 2004 Mental Health Service Act provided innovative funds. And the innovative funds were geared towards different ethnic groups. And one of them, of course, was the API, through a lot of hard work and advocacy, because they wanted to just lump Asians in one big category. And we had to fight to make sure that specific segments of our APIs were, part of the innovative funds. And what was nice about this innovative funding was that it integrated care, behavioral, medical, and substance abuse services for the first time, and allowed us to treat people regardless of age. So at that time, I was involved with PACS, and we were able to get the grant for the Cambodian community. We had to find a federally qualified health center and a substance abuse agency so we could coordinate the integrated care. So now I'm going to share with you how we used the data and the knowledge of the culture to actually guide the development of the program that we developed for Cambodians. So first of all, I didn't put this in here, but it's so important. You have to hire staff who are from your community, because they are going to be the greatest resource in terms of the culture, the history, and what will really help. We knew from the demographics that most Cambodians in LA County live in Long Beach. And one figure was around 17,000. I've heard 30,000. It's very difficult to know how many Cambodians live in Long Beach, but at that time we thought it was at least 20,000. We knew from the poverty level that many clients were going to be Medi-Cal eligible, and that was very important because the grant was geared towards Medi-Cal eligible people. We also knew from our staff that there was going to be a high rate of trauma due to what they suffered under the Khmer Rouge, in the refugee camps, and during the immigration process. At the same time, we really recognized that our folks underutilized mental health services, and it was associated with a sense of cultural stoicism and also stigma and a lack of understanding of what is mental illness. We also found that many of our clients, as we did outreach, did have limited English proficiency. And interestingly enough, there were very high levels of illiteracy, not only in English, but also in Khmer, because many of the Cambodians who came to the United States were farmers with very low education levels. And with the women, very few of them had any proper schooling. We also found that at the beginning, and actually throughout this program, most of the services were being used by older adults. We looked into it and found that many Cambodians have, of course, deep suspicion of government programs, but also they don't really recognize symptoms of mental illness in children. And they are also very much more tolerant of certain behaviors from children that we in American culture would not probably tolerate. Although now with all these helicopter parents, maybe they are being tolerated. Just an aside. And we also found that the substance abuse part of our program was very, very underutilized, and we've never been able to really get it up to a higher level. And that's because there's a very high level of acceptance for alcoholism. And the second substance abuse or abuse really is psychological or pathological gambling, which again is very accepted, not only in Cambodian culture, but also in many of our other API communities. So all of these helped us to figure out how we would present our program, and had to come from data. We couldn't just make it up. So after we were deeply involved in our program for a couple of years, we started to think about how can we increase our appeal to Cambodians. We were getting small numbers of Cambodians who were willing to try Western style mental health services, but it wasn't enough. And even there was resistance against taking advantage of the medical care. So again, the staff came through. They said, look, 90% of Cambodians in Long Beach are Buddhists, a specific type, Theravada. And the younger ones are joining Christian or Mormon churches at a fairly good rate. So let's look at how spirituality can help us be more appealing to our older Cambodians. And they recommended that we start using the Buddhist blessing ceremony as part of the treatment plan. Because for Cambodians, spirituality is not just going to the temple. It permeates all levels of their lives, from the language that they use, how they greet each other, and the holidays that they celebrate. Also, there was a feeling that mental illness came from previous bad karma, so it must be endured. Again, that cultural stoicism that I mentioned earlier. And in Cambodia, when people got sick, whether it was medically, physically, or maybe emotionally, they would go to the temple for a blessing. And because of the poverty level of many of our older adults, they did not have the funds to go to the temple to actually have a blessing. So in their minds, that was very important because they connected their health to achieve harmony, which was very important to them. So we started regular blessing ceremonies throughout the years. We had them open to not only the clients, but their family and friends, as well as the temple members there. So it became a more community-oriented blessing ceremony. And the clients really appreciated it. They felt we respected their culture, and it built a lot of trust, and it brought in more people as a result. So here's just a flyer that we put together. We would always have bilingual flyers. We also made sure that we rotated the blessing ceremonies to different temples so that we tried to keep any competition amongst the temples at a low level. There are about 25 to 30 different temples in Long Beach area alone. So we tried to be respectful of that. And then here are just some pictures I wanted to share of the types of a blessing ceremony. Of a blessing ceremony. You can see it's very traditional, and the monks are highly respected in the culture. So we brought monks in from different temples. And then here we are lighting the candles. So we tried to follow very carefully the purity of the traditions. And we were very lucky because we actually had an aja, who is a Buddhist, what we would call minister. He was a former monk, and he provided all the necessary background and rules that we needed to follow. Lovely man. So we were doing very, very well with the blessing ceremony, and the staff came up with another idea, which was we needed to have a better idea of nutrition in terms of improving the physical health of our clients. So they came up with the idea that we would start bringing clients to a temple and have one of the clients be an instructor. And then after the cooking, the monks would be fed, and then everyone else would eat together. And the monks are fed first as a sign of respect, but also because they traditionally stop eating at 12 noon. So all the meals had to be prepared and fed to them before that time period because they fast the rest of the day. We found that this was a really nice way to get family members and younger clients to come. And it gave the older clients respect. And when you think of when they came to the United States, many of the older adults weren't as integral to the family as they would be. They didn't have the level of control, respect that they would have in Cambodia. So this was a way of them, in a gentle way, reestablishing their place in the hierarchy. It was great because the younger clients started to learn about Cambodian cooking, and there was a lot of intergenerational communication. Again, they felt that they were being blessed because to feed a monk in Cambodia is a sign of respect and is a blessing. And it continued the process of honoring their spiritual ties. The unexpected result was also that it really reduced social isolation, because in the cooking and in the feeding and in the eating, people got together. So instead of clients being isolated in their one-to-one sessions, they could come together once a month and really communicate with each other. And many friendships developed as a result of this. The data is never just static. It really can be used to predict future trends and directions, and certainly to improve your current program or to develop new programs and activities. And when I looked at the Cambodian data, I started to realize that for Cambodians, there's a real decrease in older adults. That's going to impact our INC program because most of our clients were older adults. So we're really going to have to look at how to recruit and engage younger adults to consider mental health services. Also, the other impact is that unlike some of the other API communities, the Cambodians are not growing because it is very difficult for Cambodians to even get a visa to join, to visit the United States or to immigrate. So what's happening is the population is increasing, but mainly amongst the Cambodian Americans, not with a fresh influx of Cambodians from Cambodia. That I think is going to have some impact in terms of language access, because as we saw before, the data shows that more and more American-born Cambodians are fluent in English. Not only are they fluent in English, but most of the time they do not speak Khmer. And many, many times they, of course, can't read or write Khmer. So if I were looking at our programs, I would try to start thinking about how we're going to adjust the services because of the change in the age group and the literacy level of the people. We're also finding, of course, and you're going to find this when you start digging deeper into where they live, that Cambodians are moving out of Long Beach. They're moving to Covina. They're moving to Orange County. They're moving even into the valley. And so how do you provide services for a larger area? What was great is in Long Beach, it's very centralized. And so, you know, we had our associations, we had our connections with the business community, we had our connections with the temple. It was very concentrated. That's going to change if your population starts to spread out. So these are the kinds of things that looking at the disaggregated data will help you make good choices in the future for your planning. So I think I'll end there.
Thank you so much, all three presenters. I think with all three of you, we have such a rich view now, right? And it helps us to think about evolving nature of data. Thank you, Mariko, right? Our changing communities, and we have to keep track of the evolving aggregation groups, as well as the disbursement of our different populations. So thank you for that. So we can continue to take questions.
Brenna, you asked if there were many Cambodians involved in the design and implementation of the project. Absolutely. And we were very fortunate. Right now, when you consider the number of Cambodians that are hired by nonprofits, we had 8 full-time Cambodians involved. They were the therapists, the case managers, the rehab specialist. I was very involved myself in the Cambodian community, being on the board of directors, going to Cambodia twice myself to better understand the culture. So yes, at every level. And all the ideas, the nutrition, the use of meditation, the blessing ceremonies, all came from the staff who were Cambodians. It was very important to us that we respect the culture by respecting the staff who were from that culture.
And I also make a quick note about data disaggregation. There's also smaller subsets of our community. So for example, if I'm looking at Vietnamese Americans, right, I also want to be very conscious of the LGBTQ communities within the Vietnamese American community. And what are some of the more specific needs, or what are some of the areas that I would like to highlight in terms of mental health advocacy or outreach opportunities and specific areas. So I just kind of want to have us think about a lot of different subsets, and again, disaggregating not just by language or ethnicity, but really a lot of other axes, if you will.
And that reminds me that there's a new population that's growing, and that's mixed race. Many of our people are marrying out, both men and women. And so we're going to have a whole new population of younger mixed race folks that might have different needs and priorities. So we need to think forward on that.
Other things, Huang and Erica, you want to chime in? Residual thought as you listen to the other presenters, and something else came up for you that you want to share your pearls of wisdom?
The only thing that I wanted to plus one on what Mariko said was, the specific disaggregated data of our communities. government officials don't know about this issue, or like if they've heard about it, they don't really know the extent of the problem, right? So that needs to be also explained to policymakers a lot of the times, like why we need disaggregated data, why the model minority myth is a myth, specifically for the API communities, but for other communities as well. And why they need to, when they talk about equity, true equity is to center the most marginalized communities, and what those, like knowing what those are important. But all is to say that, you know, this conversation is going to be very new to some policymakers, unfortunately.
Yeah, I'll just add to that about the question that Brenna had in the chat about common disaggregation issues seen in with the AAPI community. And I think that is the issue, that not everyone is familiar with the need for disaggregated data. And I think that's across all groups, not just the Asian American and Native Hawaiian and Pacific Islander groups. And for those of you who might not have that context, you know, API as a category, I mean, part of that was historically created, and we're trying now to undo some of that because there is so much harm done through collapsing those categories, because these different groups have different needs. And when you collapse that data, you really do kind of erase the needs of one group by saying that they're all part of the same larger group. And we're not, you can see that it's not one monolithic group, but so many separate cultures within that. And I think that's important to note for all of the work that we do within our communities and counties, because when you talk about community mental health and culture, it's really honoring that culture of that community. And that might look very different for, let's say, the Hmong community in Fresno versus the Hmong community in Butte County. It might look different for the Cambodian community in Los Angeles and Long Beach versus the Cambodian community somewhere else, maybe in Massachusetts, you know. And it's really figuring out and talking to the members of that community and being able to work with that community about what their specific needs are. And I think that speaks to, sometimes there isn't data on that specific community, but being able to get close enough data, and then hopefully encouraging state agencies, community members to be able to generate new data so that we can know more about those specific communities.
There's a question being asked. This is Jeremy. I'll just read it off. Camelia Louis is asking, any suggestions on how to reframe advocacy so that we're not pitting AAPI communities against one another?
Well, I'm not, actually, I don't know if Huang should answer this or not, but you know, the API Equity Alliance, formerly known as APCON, is a collaboration of about 40 API nonprofits. And we have for many, many years always tried to work collaboratively. And I think that's one reason why there's so much unity. That's why, you know, SSG, PACS, all of us can work together. We oftentimes go for funding together under AAPI Equity Alliance. And that really cuts down on the competition against each other, because we have a sense of harmony within our own organizations and with other organizations.
And I'll chime in to say that even broader than that, we want to do our work cross-racially, right? We want cross-racial solidarity to be one of our main tenets of our work, right? Why should we all compete for this tiny slice of the pie when historically the pie belonged to, you know, those in power always? And so we want to now reframe the conversation. We want to work with our Black, Indigenous, and Latinx communities to make sure that government funding is equitable truly and centers our communities, where historically they have centered white, straight communities, you know, for forever. The system was created for that, and now we want to change the system, and that's why we will often run into a lot of obstacles because they were put there on purpose. And so the only way we can really truly get out of this is through working all together with all communities.
There's a question in a chat from Pamela Inaba. It says, where can I find the outcomes for the Cambodian project?
I was going to respond to that, Pamela. Since I've retired, I don't have access to DMH. Is there someone still in charge of the innovation projects? Because that was shifted to.
Yeah, I can help find, but Pamela, I think folks at DMH, there are still people being in charge because the ISM and the innovation projects, some of them are ongoing. They still have funding, and some of these projects are still happening in LA County. So Pamela, you should be able to get that data, the outcomes data from DMH specifically, because they collect the data from each of the organizations. So Marcos is one example, and then they've got other innovations project in LA County. So the ICM, and so they'll have that. And we have the Equity Alliance Mental Health Committee meetings. I think sometimes, Pamela, you log into us, so you can email me and then I'll find out who at DMH that you can contact.
I wish I had Erica's presentation while I was looking up all the data. I learned so much from your presentation on how to maneuver the U.S. Census Bureau.
So Marco, this is what you send over to your staff, right? The recording of this, send it over to the staff, right? And the Cambodian
groups.
Yes, and your Cambodian groups, right? And this is what we want. We want all the small CBOs, all the folks to have this presentation so that they can go, oh yeah, I'll go start going to look at that. Yeah.
I want to send a very sincere thank you to Mariko, to Huang, to Erica, for a phenomenal presentation. I think the way that each piece of this presentation was threaded was so well done, from the nitty-gritty data pieces of like, how do you start to look at disparities, and then how to put those disparities into context with the larger systems that are happening, and how do we advocate for change? And then moving forward, how do we put that data into context and include it in the ways in which we develop programs so that it's the most responsive to the communities that we're looking to support and serve. So really well done, you all. Thank you so much for a wonderful presentation. I'm just going to close out with a couple last things for folks to know. As Trang had mentioned, if there are questions that came up that weren't addressed, or you're starting to reflect a little bit more after this presentation, please do go to the cmep.org website where you can put in a TA request. We'll connect you with folks like SSG and other partners that we have and consultants that we can work with through the CMEP TA Center, so that you can get some deeper dive support. We can help with like diving into resources, looking for like written resources, looking for additional trainings, connecting with consultants who can start to walk you through some of these things. We're happy to provide that level of support. Again, just put in a TA request. Please do reach out. Our email information is on here. Our website is on here, as well as our social media. Get connected. Thank you again to all of our presenters. Thank you to the CARS team and support of all coordination for this event. And thank you to all of you for attending and sharing space and being so thoughtful and reflective. I see all those chat questions. Thank you for jamming with us when we came into the session. This was a really lovely experience. So thank you all and take care.